Hello, my name is Sharon Reynolds-Kyle. I'm a Shockwave practitioner here in Northern California. I've been utilizing Shockwave therapy for over 10 years now, and I take a multimodal approach in which I combine it with radial pressure waves along with EMTT. I have been teaching in this country and abroad for over 4 years and have presented case studies internationally on Shockwave therapy. As I mentioned, I utilize all three modalities in my practice, and today I'm going to talk to you specifically about osteoarthritis, which is just one example of how efficacious these three modalities are for various musculoskeletal conditions. Osteoarthritis is the most common form of arthritis affecting millions of people globally. It causes joint pain and restricted joint mobility, thus severely affecting patients' quality of life. Common treatments for osteoarthritis are typically limited to pain medications, steroid and other types of injections, physical therapy, and then eventually surgery. The beauty of shockwave therapy combined with radial pressure waves and EMTT is that it's very non-invasive. It's not going to hurt the tissue at all. It effectively reduces pain and inflammation and enables you to be able then to increase your rehab and get stronger with your physical therapy exercises so that your quality of life continues to increase. So shockwave therapy are sound waves. They're 1,000 times stronger than ultrasound. They're going to stimulate your body to lay down brand new blood vessels, thus increasing circulation. They're going to downregulate the pro-inflammatory cytokines, thus reducing the inflammation in the area. They're going to modulate your pain fibers, thus reducing your pain. And they are also stimulating the release of human growth factors, which is essential for tissue repair. There are so many benefits to shockwave therapy on a cellular level. I could go on, but for brevity's sake, I think we'll stop here. You get a sense of the major things that it can affect. If you want to research more, you can go on my website and see all the other things that shockwave is able to help with, including breaking up scar tissue, which is huge for so many of us. So my practice is very unique because I also utilize EMTT. Most of the practitioners that you see out there are going to be utilizing radial pressure waves. You will find some practices that are utilizing both radial pressure waves and focused shock waves, but it's very hard to find practitioners that have all three modalities. And the benefit of that is that the EMTT is able to increase the efficacy of the radial and focused shock wave by up to 35%, according to the research. Here are a few things for you to consider when looking for a shockwave practitioner. You want to look for someone with significant experience and ideally certification as well. You want to find a practitioner that's using high quality machines, such as the store's machines that I use. And finally, you want to find a practitioner that can target the appropriate tissue. For example, according to the research, the bigger joints, such as knees and hips, are going to respond very well to both radial pressure waves and focused shock waves, whereas the smaller joints, such as the hands, ankles, and feet, are going to respond much better to focused shock waves. I hope this has been valuable to you. I encourage you to do your own research. There are incredible research studies out there with very significant results. You can also go on my website. There are many resources available on it, and you can read about the various other benefits that shockwave and EMTT can offer you. Thank you, and I hope you stay healthy.